Blood culture in enteric fever. So first we will talk about blood culture positive with weeks of illness. So blood culture is a method of choice in the first week of illness. It shows 90% positivity rate. In second week, the positivity rate reduces 75%, third week 60%, and after that till fever subsides only 25%. So blood culture remains a very important investigation in first week of illness. What is the ideal timing to collect blood culture? Ideally, it should be collected before starting any antibiotics or antimicrobials. If antimicrobial is already started, then collect before the next dose of antimicrobial. How many sets should be collected? Ideally, two blood culture sets should be collected, and these two sets should be collected from two separate venipuncture. If there is a central line present along with peripheral line, then you should collect one set from central line and one set from peripheral line. Each set should have one aerobic bottle and one anaerobic bottle. For adult bottle, we collect 10 ml of blood per bottle. For pediatric patients, we collect 1 to 3 ml bottle per. We have to disinfect the skin before the blood collection. For that, we are using 70% isopropyl alcohol followed by povidone iodine or chlorhexidine. We should apply this in a circular motion of 5 cm in diameter starting from inwards to outwards. Allow it to dry before venipuncture. We have to dispense the blood in blood culture bottle. So that should be done at bedside. We should not change the needle. It is not required for this. Then mix well and transport to lab. If you suspect that there will be transport delays, then never refrigerate these bottles. Either keep them at 35 degrees centigrade in incubator, or if that is not also available, you can keep them at room temperature, that is 25 degrees centigrade in the room. There are two types of blood culture methods available. One is conventional blood culture mode. Here we have two types of medium. One is a monophasic medium, which use a brain heart infusion broth or BHI broth. We use 50 to 100 ml of this broth per bottle. Then there is a biphasic medium, Castaneda's biphasic medium. Here, along with this broth, which is 50 ml, we use one side agar slope of the same medium. So BHI agar along with BHI broth. We have to inoculate 10 ml of blood in 50 ml of medium minimum so that 1:5 dilution is achieved. This will inhibit all antibacterial components in the blood which can prevent the growth of bacteria. The anticoagulant which is used is SPS, sodium polyethyl sulfonate. It counteracts the bactericidal action of blood. Then you have to incubate bottles at 37 degrees centigrade for at least 7 days. The subculture from BHI broth to blood agar and McConkey agar should be taken. From monophasic medium, the indication for this subculture are usually when you see or the bottle shows the signs of growth, or you see the signs of growth in BHI broth. Or you can take periodically blind subculture for 1 week. But this has a risk of contamination because for taking subculture you have to open the bottle. So each time you open the bottle there is a risk of contamination. Here the biphasic medium is of use because you have to just tilt the bottle on agar slope. So for subculture you have to not open the bottle. So less risk of contamination, and you can also find separate colonies on agar slope which can be further used for identification. Then the second method apart from conventional is the automated blood culture. Two most commonly available systems are BACTEC and BACT-ALERT. These are having lots of advantages over the conventional system. The continuous monitoring of growth and recording of every reading every 15 to 20 minutes is available. So it has a faster isolation rate with higher sensitivity, and it also helps us to diagnose a catheter-related bloodstream infection by determining differential time to positivity. Once you detect a growth in this that is generated by a positive signal in the system, then bottle is removed and processed for subculture to blood agar and McConkey agar. So that is the blood culture in enteric fever. Let us look at the summary. So we were discussing blood culture in enteric fever. First, we have discussed blood culture positivity with weeks of illness, in which it has been shown that first week of um, illness shows the maximum positivity. The ideal timing is before starting antimicrobial. If you have started, then before the next dose of antimicrobial. Two blood culture set. In each set, two bottles, one aerobic, one anaerobic, 10 ml for adult bottle, 1 to 3 ml for pediatric bottle. You have to disinfect skin using alcohol and povidone iodine, and you have to dry the skin before taking blood. You have to dispense at bedside. Transportation delay, you can keep bottle at room temperature or an incubator. There are two types of blood culture method, conventional and automated. So I hope this clears your concepts in blood culture for enteric fever.